Assalamu alaikum. My name is Dr. Abdul Momin, and I'm currently working as assistant professor at University of Lahore Islamabad campus and also as consultant clinical dietitian at Ali Medical Hospital, Islamabad. So today I would like to present this very interesting research on iron fortificants and prebiotics, a combination approach to combat iron deficiency anemia. So as we know that the current world population is approximately 7.7 billion, and it is growing at a rate of 1.4%, and the projections state that by the year 2030 we will reach a figure of 8 billion, which is definitely huge. Interestingly, as the population is growing, we are definitely in need of more food requirements so as to feed the population across the globe. However, there are several malnutrition related issues associated with this. Micronutrient deficiencies or hidden hunger is one of the biggest malnutrition related issues these days, and it has been estimated that approximately 2 billion people are affected by micronutrient deficiencies worldwide. Most common micronutrient deficiencies include those of iron, iodine, zinc, folate, vitamin A, and even vitamin D. Major consequences of micronutrient deficiencies include poor health status, stunting, mental retardation, decreased learning abilities, and reduced capacity to perform work, and premature death. Any age group can be affected by micronutrient deficiencies. However, the most affected age groups include those of infants, under 5 children, women of reproductive age group, and pregnant and lactating women. Iron deficiency is recognized as the biggest micronutrient malnutrition worldwide, and it occurs in several forms. Anemia is the most common form, and iron deficiency anemia is one of the most common forms of anemia. Now, when we talk about prebiotics, a prebiotic is any non-viable food substance component which is partially fermented by bacteria in our gut, and the prebiotics have the ability to improve the health of the host. Now, there are several reported health benefits of prebiotics, which include prevention of colon cancer, reduction of cholesterol levels and thereby reducing the risk of cardiovascular diseases, reduction of severity of inflammatory bowel diseases. Then prebiotics also help in weight loss, and last but not the least, recent reports have suggested that prebiotics can also help in the increased absorption of divalent minerals such as calcium, magnesium, and iron. Now, when we talk about food sources of prebiotics, these include chicory, onion, garlic, leeks, chickpeas, lentils, barley, oats, and bran of cereals. And there are several prebiotics which have been identified. The most important ones include inulin, galacto-oligosaccharides, fructo-oligosaccharides, mannan-oligosaccharides, and xylo-oligosaccharides. Now, there are several theories which have been put forward when we talk about how prebiotics can actually help in increased absorption of minerals. One of the theories suggests that prebiotics, when consumed, they produce osmotically active sugars which increase passive absorption of minerals and produce weak acids. These weak acids then decrease luminal pH and convert the ferric form of iron into the ferrous form, which we know is the more readily absorbable and more soluble form of iron in human body. Then another theory suggests that prebiotics are fermented in colon and they produce short chain fatty acids. These short chain fatty acids actually enhance the surface area for absorption of minerals such as iron or calcium. Another theory suggests that prebiotics, when consumed, they turn on those genes which are involved in regulation of iron absorption. So these are the 3-4 different theories. However, researchers are now not absolutely confirmed as to which theory is the most accurate one as of now. Now, a little bit about the global prevalence of iron deficiency. It has been estimated that approximately 50% of all pregnant women worldwide are suffering from iron deficiency anemia. Similarly, iron deficiency contributes to about 0.8 million deaths every year, which makes 1.5% of the total deaths. Now, the situation in Pakistan is also quite grave. When we have a look at the National Nutrition Survey of 2011, it was stated that approximately 50 to 51% of pregnant as well as non-pregnant women had low hemoglobin levels, and same was the case for hematocrit levels. And the recently conducted National Nutrition Survey of 2018 has also indicated that approximately 41.7% women of reproductive age group in Pakistan are anemic, which is definitely a very alarming figure. Now, when we talk about prevention and treatment, 4 major strategies have been identified by the World Health Organization, which include food fortification, dietary diversification, iron supplementation, and biofortification. I will quickly go to the food fortification part only, which is the focus of the current research. So for fortification, we use different vehicles such as cereals or wheat flour, milk or milk products, oils and fats, and infant formulas as well. Cereals are, however, the most preferred option because cereals are the staple food in this part of the world. They have been found to be quite efficient in terms of serving as fortification vehicle. They are cost effective, and they have been better accepted by the consumers. Now, the major objective of the current research was to probe the synergistic effect of 2 prebiotics, that is galacto-oligosaccharides and inulin, and iron fortificants, that is ferrous sulfate and sodium iron EDTA, on 3 hematological indices, that is mean corpuscular volume MCV, mean corpuscular hemoglobin MCH, and mean corpuscular hemoglobin concentration, that is MCHC. And for this purpose, iron deficient female Sprague dolly rats were used as the models. I have already explained this, that we used female Sprague dolly rats, 2 iron fortificants and 2 prebiotics. As I have already mentioned, these were used for the purpose of this research. For the treatment plan, we used 2 control groups. One was the positive control and the other one was the negative control group. Then we made 8 groups of rats using combinations of inulin at 722 and 963 mg per kg, along with 10 and 20 ppm NF-ETA and 15 and 30 ppm ferrous sulfate. Another 8 groups were formed using galacto-oligosaccharides as the prebiotic at dose of 722 and 963 mg per kg, and 10 and 20 ppm NF-ETA along with 15 and 30 ppm FeSO4. So in total, we had 18 groups, 2 control groups, and 16 treatment groups. Now, human equivalent dose was used for the purpose of calculating prebiotic doses. As we know that recommended dose of prebiotics for human consumption is 6 to 8 grams per day, and accordingly doses were calculated for the rats. Now, the rats were procured and they were fed with a standard diet for 1 week acclimatization period before we started the experiment. They were housed in stainless steel cages with maintenance temperature of 23 and relative humidity of 55%. 12 hours light dark cycle was maintained, and for inducing iron deficiency anemia, rats were initially fed with iron binder carbon tetrachloride, and then baseline values were attained. Fortified feed was then fed to rats orally on daily basis for a period of 12 weeks, and then blood samples were taken at baseline, 30th day, 60th day, and 90th day. These 3 were the hematological indices which were determined. Statistical analysis was performed and ethical considerations were ensured. Now, the results showed that in terms of MCV, MCH, and MCHC, all the 3 hematological indices under consideration, there were significant variations with respect to groups, study intervals, as well as the interaction between groups and study intervals, as indicated in this particular table. Now, quickly having a look at the MCV levels of iron deficient female rats. The right side of the graph shows that as the study progressed, the levels of MCV significantly increased from 0 day to 30th day. However, after that, no significant increase was seen. On the left side, if we can see, the highest values among the treatment groups were attained by the group G4, which is the pink one, and then group G8, G12, and G16. Almost similar trends were observed for MCH levels among the iron deficient female rats. So as you can see on the right hand side, MCH levels of the iron deficient rats were significantly increased from 0 day up till 90th day. And on the left hand side, if you can see, highest values were again attained by the group G4, G8, and G12. And lastly, for MCHC levels, again looking at the right hand side, levels of MCHC were increased from 0 to 30th day and from 30th to 60th day. However, no significant increase was seen from 60th to 90th day. And similarly, group G4, G8, and G12 attained the highest levels of MCHC during the experiment. In conclusion, what we concluded was that addition of prebiotics to iron fortificants could be an effective intervention to overcome the problem of iron deficiency. And prebiotics and iron fortificants not only improve these parameters associated with iron deficiency, but also help enhance absorption of iron among iron deficient female rats, which was evident from other parameters, which were definitely beyond the scope of this particular presentation. So, dual benefits of prebiotics can be actually attained by their consumption with iron fortificants, that is, enhanced iron absorption, and we know that prebiotics are also very good for our gut health. What we recommended was addition of iron fortificants like ferrous sulfate and NAFEDTA should be mandatory in food system to overcome iron deficiency. In this regard, some of the wheat flour mills have already been adding iron fortificants to the wheat flour, which is a very good step. Moreover, industry, academia, and health trio should be harmonized to tailor need-based research related to public health nutrition, such as this one. And lastly, community-based trials and cohort studies using human models are warranted, so that we can be sure that such results can also be attained from human models. And this could actually be a very, very good step in terms of overcoming the problem of iron deficiency, which is mainly affecting the women of our country. Thank you so much.
Thank you, Raksha. Raksha, it was a wonderful presentation, and thank you so much for concluding within the prescribed time period. And Dr. Abdul Momin was talking about the iron fortificants and prebiotics, the symbiotic effect of both of these very valuable nutrients. And we'll definitely support your recommendations that we should go for the industry, academia, and health trio. And for this, the One Health group could be formed at food science and nutrition level, and that One Health group could work in collaboration with the industry and academia as well as the health related industry, particularly the hospitals. And we can just then in that case we can extend our research and our findings through the hospitals, and we can just go for the data collection in the cohort studies as you mentioned. Thank you so much.